Good evening, everybody. Welcome by Mindful Elevation, where we're going to have another interactive Saturday. Today, we're going to have Miss Carina Engelhardt, where we're going to talk about what it is of being an entrepreneur, what it is of having your own business, and the different challenges that you encounter while you building up your own business, but also all the positives that come along with it. So welcome, thank you. Welcome, Miss Carina. How are you doing?
I'm fine. Thank you for the invitation. I'm very happy to be here today, and you can talk a lot about all this was going on in my life.
You're most welcome, and thank you for accepting the invitation. So before we continue, welcome everybody else. If you have a question or you have a comment, you're always more than welcome to put it in the chat, and then in between we will go over your questions or remark, and then we will comment about it. Okay, so Carina, so tell a little bit about yourself.
Hey, let's see. I'm a 41-year-old young woman. I have two boys. I have one of 12 and one of 9. I'm a very busy person. I love dancing, getting together with friends. I work out a lot. I had my education here on Curacao. I went to the Alderswijzer School. After that, I did Radolfus College, where I finished the VWO. And in '98, I left to Holland, where I studied at the University of Radboud, where I did dentistry. I graduated as a dentist in 2004. After that, I worked in Holland for several years, getting some experience before coming back home. And after 2 years of working in Holland, I came back. I started working with colleagues, and now I'm the owner of my own dental clinic, Denti Curaçao.
Nice. That's impressive, actually. Because you have your practice in Curacao, correct?
Yes.
Okay, that's nice. So, how come you decided to become a dentist? Was this a dream that you always had, or how it came about?
I don't really know why I chose this back then, but I can tell you that I would do it all over again. I really love my job. I think it's a perfect combination for me of helping people, the medical assistant, the creativity that you need to do this job. And it's also very technical, and it's a very technical profession. So it's the perfect combination for me. I'm the crafting people, crafting person. I like doing things, making things happen with my hands, and the part of helping people. It fascinates me.
Okay. And when you finish your education, because that takes around how long, like 4 to 6 years?
6 years.
6 years. And then is it from year 1 till year 6 that you're studying for to become a dentist, or is it a general thing first and then you specialize?
No, the study is dentistry, so you start to be a dentist, and it's not like the medical school where you start doing general medical and then you specialize. The study is just dentistry, so it's the whole 6 years that you do that. You're studying for dentist as a dentist. And what's actually very interesting, I think, about the study itself is that it's very practical. From day one, you start practicing on patients. So it's a very practical study.
Okay, that's good. And then after that, you stayed in Holland, and then you worked a few years over there as well, correct?
Yes.
How was that experience?
Um, it was a great experience. It was very new. Remember, we leave Curacao to go to Holland, where we become adults there. So it was my first job as an adult, and but it was very good for me because I had the opportunity to work into different areas of dentistry. I did half of the week I did pediatrician, so working with kids, and the other half of the week I worked in a general practice where I could do everything, and I had a very good mentor, the dentist that I worked with, and so I learned a lot because when you just finish dentistry, just finish university, I think like all the other studies, you need to get some experience to get on the field, in the field, and so it was a very good decision to stay before coming back, and because also living on the island, of course, you don't have so much opportunities for courses and things like that to get more experience like living in Holland. So it was I'm very happy of that decision that I made back then.
Okay, that's nice. And how long you stayed in Holland to get your experiences?
2.5 years I worked there.
Okay, okay. And then after, when you came to Curacao, where did you went to work, or how did you go about it?
I came back. I had the benefits that my aunt has also had a dental clinic. So I started with them, working with them at Apollonia Dental Center. I worked there for 5 years. This was also very, I learned a lot also there. I learned our system, because that's another issue. The insurance system, the people here is very different from in Holland. What their expectations are, how to handle them. And so I learned a lot there. I also worked part-time in other clinics. So I always worked as much as possible at different places, helping colleagues, like the emergencies, things, and the weekends. So to know more about the system on the island and the patients. That was very.
And then after that, what was so after the 5 years, what was the next step that you took?
Yes, then I came to a point where I wanted to have my own thing. I think as a professional, you started something, you wanted to be on your own. I think for me, it was like that. I wanted to do something that I just wanted my own space, show my own talent. I have my own ideas. So after 5 years, it was time to move on. So I started looking for places to go where that I could rent, to put my own chair and have my own things. And so I finished at my medical with my big friend Jerry Semper. I rented there a unit. It was a medical center. We had a dermatologist, a lot of specializations. So it was a whole different story, whole different experience, working with other fields in the medical. So it was very interesting and learned a lot again. But then I was on my own, so I just rented the unit, and I think that was the beginning of owning my own business, because then I was on my own. I was the worker in the business, but also owning the business, and it was a big step.
Okay. So during that time, it was more that you were renting a space by the other clinician, doctors, but then at that same time you started building up your own business, so it wasn't that you were falling under them.
No, no. Everybody was independently renting spaces, but we were sharing the waiting room, the parking lots, the reception, things like that. So it was a very different setting,
Mm-hmm.
uh, like we used to have in a dental clinic, because most of the time dental clinics are only dentists, or with an oral surgeon or something like that. That fits the same idea, right? So
Yeah.
now we had uh, like 5 different disciplines we had in the medical center.
Okay, okay. And then how long before you decided to go completely on your own? Because I could have imagined that renting a space, you still could have feel like a little net that is there for if you had any questions or anything that you could have go to one of your colleagues and ask them. But then at one point you went completely on your own. So when that took place?
Okay, when I started renting, I'm a planning person.
Mm-hmm.
So my whole life was like planning when to graduate, planning when to go to Holland, planning when to get my driving license, planning when to get kids, and so I gave myself 5 years for
Mm-hmm.
renting this space to go on myself. I really wanted to have my own building. I wanted to own my business, but I really wanted my own building also. And again, if I could do it all again over, I would do it all the same way, because this gave me the opportunity to go step by step and seeing what I really want when I have my own clinic and what I don't want. And I think that's very important to learn from everything, every step, because this gives you a lot of information that you don't have to go wrong on it to know that you shouldn't do it like this. So that was a very useful 5 years
Mm-hmm.
um, to form for myself what I want, what I really wanted to be when I'm going to my own building. So after 5 years, I always had the support of Dr. Semper, and I started looking for a building, for a
Mm-hmm.
house to build or to construct. And then God gave me this one where we are now. We are located at the Perseusweg.
Mm-hmm.
It's a very it's very building for me. It was a house. It was a family house. Um, Actually, it stood there for years. I ride always in front of it, and I never saw it standing there. I thought I couldn't afford it. Um, I actually almost bought the neighbor house,
Mm-hmm.
um, and then something went wrong, and the owner just sold it to someone else, and I had this contract signed, and everything was there, so I could have been a little more strong on it and fight for it. But I thought this is not the way I want a business to start. If it's for me, it will come for me. And one day I saw this house that I thought I couldn't afford,
Mm-hmm.
and it appears that this morning they just lowered the price
Okay.
that I called. So it was. I really think it was meant to be. It's my dream come true. The
Mm-hmm.
the the size, the location, even the palms in the garden. So so we bought a house, and we constructed, and there was not so much to do to change at the spaces, and that's how. Now, after 6 years in the Mahai Medical Center, because it was like 1 year of looking and searching, and but it's very um, what I can tell is it's so much different between in these 6 years. You change so much. I remember the first time when I went to the medical center, this first step was so insecure and so scared. That's why it took me 7 years. But this day when I decided, okay, I gave myself the 5 years, so the 5 years are over. I worked very hard. I just went and go to see to the, how do you say that, my financial statements and go to the bank, and I was so secure. This was the time I need to do this. The time is there, and this is just the next step, because I was so secure about my plans. And I did it once without anything. So it felt so right, but I think it felt the mature of the business woman in me that I became after 6 years, because this is also a very big step afterwards thinking about it. But it felt so different this time.
Yeah. Okay, and then so then now we kind of like covered how you reached to you having your own practice, your complete own practice at Persuaseware, and then now you added being a orthodontist as well, right? So how that went about?
No, I had a little step before that, because working at a Mahai Medical Center, I'm not an orthodontist, because orthodontist is a nomination that we in Holland we give another study, the orthodontic study. But what I have is I finished dentistry with the specialization of aesthetics and orthodontics. So I had it in my study. The first 5 years you do dentistry, and the last year you choose the directions that you want to specialize in it. So I did not do the whole study, because it's a 4-year study in Holland. It's not everywhere the same, but I did this 1 year extra specialization for orthodontics. So I always had it. So before leaving to my own building, the space was not enough at a medical center for me. So I rented another space at another place. And there I started like only my orthodontic section. So that was before that. And when we went to our own building, then here I have 4 rooms for treatment rooms, and had everything on one roof. So orthodontics was always my thing. I always had it, but it's in time. And also with the recognition of the SVB insurance company, it gets busier and people know more. And of course, with the recommendation, more patients you do. So that's it's a very big part of my clinic.
Okay. And then how you able to combine it? Because then you I assume it's a few days a week you does see patients as a dentist, and then a few times a week you does see patients to do the aesthetic part.
Okay. What I tried in my clinic is to make it a concept. What I mean by that is, in the beginning, it was very difficult, because you're the doctor. Everybody wants to come with you, and they want you working on them with your hands, with your style, with your communication. Exactly. So that was very difficult to grow, because I couldn't do more than that with my 2 hands. So I started training assistants. So by now I have 2 assistants, orthodontics assistants that I trained, that most of the time they do the orthodontics. Orthodontics is, it's very important that you make a very good plan. So the plans I make, I give the instructions, and I have afternoons, because most of the times it's kids, so most of the times it's in the afternoons that I have my assistants working, and sometimes we have 2 or 3 treatment rooms that are doing orthodontics, and me walking around and giving the instructions. So we combined it all. I do dentistry the whole day, and because of my assistants, I can do also the orthodontics at the same time.
Okay. Okay. So now we know a little bit of how your career has been going from day one to now. So let me go back a little bit at the beginning, because you mentioned that when you started in Curacao, with by your end, you were young, you didn't have so much experience as in trying to build yourself up to have your own business. So what is the difference between then and now, if we have to look at you as a businesswoman? So besides being having the profession dentist, but now as a businesswoman. So can you explain us, or can you tell us a little bit about the difference between then and now, how you grew?
It's a whole another person. That person of how long is it? 13 years ago that came back to Curacao. It don't exist anymore. Having your own business changes you a lot if you want to do it right. So I'm not there yet, but I learned a lot in the process. I learned a lot the hard way, because I think something most of us do wrong is we are a worker in the business, and we don't realize that we need to work on the business, because now we are business people. And most of us start a business because we can do something very well. So we can make very good bread, doesn't mean that we can manage a bakery. So that was something that I conflicted with a lot in the beginning, because it was too much. I was a worker, I was the owner, I was the director, I was the tax manager, the financial manager. And of course, being a mom, being a wife, being a daughter, being a sister, being a friend, so having my own house, it was a lot. So time management is a very important keyword in this all. And I think especially I can say, I think, as a woman, I need to say that I had a business coach session. I did a business coach session with an action coach. My coach was Arthur Rosaria, and I learned a lot. So that's something I can advise people that wanted to start. You need this change, because you need to go from the worker to the owner, and so different. It's different world. It's just not the same person. You cannot do that. You have to know how to become to lead a business, to do so, because not just doing your work well will do it all. So it's a lot in a way. I don't know what to tell you, but like I told you, if I can compare this lady of back then when I started and today, it's a lot of different. I can say, like, to give an example, the one of the biggest problem we all have, and I think I can talk for like almost everybody if I call it a problem, is like the tax authorities. So this is something shouldn't be a problem, but it's something that's so far from us as the technician, like we call like the worker. Okay, so like for a dentist, I don't know anything about the taxes, but it's so important for your business because this can make you and this can break you, and it takes so much time and effort to do it right, and even then it seems like it's never right. So it's something that you just have to incorporate it in your life, because it appears that it's just part of your constantly things that you have to do and manage constantly. So, but those are things like personnel, workers. Being a boss is not just telling them what to do or paying them, but becoming a leader, becoming an example, becoming a person who can give support, um, physically, emotionally sometimes, but also being hard sometimes, and straight, and keeping the rules. So it's a lot to do, and I think that if someone wants to start a business, I would say that you really have to be careful that you don't business like a technician. You have to start it like with a business mind.
Yeah.
But and be prepared for it. Be prepared. Be prepared for all these things, that because every business has some things that it's all about, like the taxes, like the workers, like the financial reports, and most of us don't understand those reports. So
Correct. I'm one of them.
yes, and me too. But I learned the hard way that you really need to do it. You have to
Yes.
become an accountant. You have to become a fiscus. You have to become a social worker. You have to. You have to, because
Yes.
you cannot just pay people to do everything for you. You pay them. You're the one responsible. So you need to check if they are giving what you need.
Correct.
So one way or another way, you really have to reach this level, at least some level in all these areas, to cover it all, because you will feel it. It will come back to you, and you just can go and bake breads and think that
Exactly.
it will go.
That is so true. And like you just say it now as well, and you keep on hearing it from everybody, that you need to know at least the basic of every aspect of a business for you to be running a business. But then you're thinking that, oh yeah, but I love to make bread, or I love to make ice cream, so that's what I'm going to concentrate on, and whoever else can do the other things. But it's like you said, at one point you will butt your head, and then you will be like, yeah, I should have do that way earlier, and pay attention to, like you said, the taxes and everything, to know what is going on with your business before it goes down the drain, or something else.
I think I think I don't know if it's true, because I'm speaking from my perspective, but
Mm-hmm.
I think this is the tricky part. Um, Technicians that wants to have their own business, because I can imagine if you started business, and you go and manage a business, that's your job. But
Mm-hmm.
the thing is with us is that we want to be the worker, because most of all you want the business to do your work free,
Correct.
at your style, at your moment, at your space.
Yeah.
So you're doing this because you want to work in it, but at the same time you have to manage it. And I think
We
that's a
forget that.
mindset that needs to change, or at least not, maybe not change, but at least be aware of it, that what's going on,
Correct.
and that
Correct.
you have to do both.
Exactly.
You can do both. At least you have to manage. If you want, you can work, but you can't only work without manage. So
Exactly. That is so
yes,
true. That is so true. Like Lanza is saying, sometimes a disappointment leads to perfection. And Michael is saying that you're a leading boss lady. So yeah, sometimes
yes,
it's indeed when you grow in your business from the let me call it the mistakes you're making, you're learning and you keep on growing. That is so
you,
true.
yes. You know, you learn from deceptions. That's another thing that I was thinking about. I think it's very important to do something you love because, again, is the way you see things is very important. Um, and I think it takes love and passion to see the positivity in everything.
Yeah.
So I had a lot of setbacks, I can tell you, financially, taxes, colleagues, workers. Um, so um, I cried a lot because I work with so much passion, and I wanted to build a family. It's my family. I'm always at my work, and my assistant is my family, is my friend, and they know everything about myself. So those are things you learn that shouldn't be like that, you know. And in the past, I really cried. I really cried when someone did me wrong, and I couldn't understand it, and or they just leave, or things like that, or a worker just go. How do you say AO?
Um,
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 Call in
uh,
sick,
yes.
you know, and you
Hmm.
know it's not true, and you think you're being so good for them, and then they stay home 6 months, and you just have to pay like that, and it's those things. I it don't fit me. People do that, and I have to tell also like one thing that is very painful. I think
Hmm.
is that I really feel, and I hope I get rid of this feeling one day, but I really feel, and of course, after this COVID problem, that as an entrepreneur, you're so on your own. So everybody has rights, but not you. You're
Correct.
always the monster. You're
Yes.
always the bad one. You're always the one that only want to get more money, and it's not enough for you, and you don't want to pay them more, and you don't want to give more. It's and if they are sick, if workers are sick, it's okay. But if I'm sick, I don't get paid.
Hmm.
Um, if you know, it's if there are problems with personnel, they always have rights, but I don't. We as employee, you don't have. The only right you have to is to zeg je je hebt plichten.
Yeah. The rights. No, no, no,
But
no. The yeah, the rights for the
they have
workers.
rights,
Yes, correct.
yes,
Mm-hmm.
but I only have to give. Let me
Yeah. Mm-hmm.
state it like that. So that's very disappointing that you won't get that support um, from the government, from the as well way, you know. Um, it's like you always will be wrong, and you're always paying at the
Yeah.
end. So that's very disappointed. And sure, there's a lot of disappointment, but it's very important that you have your vision, where you're going and why you are doing this, and doing it with love. Because at those points of disappointment, you that's the only way I think you can get strength out of it, and to go on, and to um, motivate you to get better, to do better than it was, and to learn of it, because it's very tempting to give up,
Yeah.
and to
Correct.
in those things, because you as an entrepreneur you think like, wow, because I have the courage of getting on my own to start a business, um, um, taking money from the bank, have such a big schuld,
Yeah, debt.
debt, put myself in such a big debt, and I'm providing work for families and so much uh, not only my customers, but the other side, providing work, providing, you buy things
Security.
from. Yes, you have the cleaning lady, you have the security, you have the car wash, you have the garden one, you have the workers, all these people, um, and then you think, why? It's like I'm a social worker. I can't do this for my own, you know?
Yeah.
But there's a passion you have and you want to do all this, but when it gets to you, you're on your own.
Yeah.
So this is very disappointing, I think, from the point of view from the government, from the support that I think entrepreneurs should get. Because if you don't have entrepreneurs, if you don't have business, you don't have work, you don't pay taxes, and the whole community don't. You need business
Yeah.
to help the community. So I think people can think more about that. I thought a lot about that in the COVID and the problems we had and the comments we get when everybody is in panic.
Correct.
But I think it's something that people should think about.
Yeah, correct. Because over here is actually the same experience. They don't, sometimes some of the workers, but also government and outside, they don't really think or try to see it from your side. They always go about the workers, or even the workers, I just come in to do my job, I getting paid at the end of the month, and then whatever happened besides that, if I want to stay home a day, I stay home a day. Whatever happened with the job is not my problem. I know that at the end of the month I'm getting paid. And then you, as the employee, the boss, you, like you said, you really have to make sure that you don't get discouraged, and have your vision in sight, so you know why you're doing it for, and what you're working for. Because otherwise you will start your business today, and then in a month you might be closing it, because all the things that come with it, you might not be able to handle it. That is so true.
That's so true.
Yeah.
I saw a question of Lens, how to
Mhm.
combine family entrepreneur. Um, it's not easy. I think it's very important to tell that um, you have to have support. Your family, I think, is very important. As a woman, I had a lot of support from my parents, my sister, even my friends, my husband. So with the kids, because I had my kids were small, so my mom and my kids play tennis. I'm a tennis mom too, so all my weekends I'm at a tennis court, and so it's a lot, and they have to live, of course, and go on, and everything needs to go on. So time management, it's not easy. It has been a long time that I slept in the afternoon. I stand up early in the morning. I work out in the morning. I start working. I bring my kids to school at 7 o'clock. I work all day. Um, I'm home sometimes at 7. For now, they are bigger. They stay home alone. So because of the lockdown, they learned a lot. They learned cooking. They learned cleaning. So everything has a positive side of it. But it's not easy. But it is possible. But I can tell you, it's sometimes no, lot some years ago, I went to a course of this lady, and it was a business lady, and it was a very important thing for me, because I was just starting and all this was going on, and um, your parents think that a mom should be home and you shouldn't have a babysit, and you should be there for your husband and your house and this and everything that a woman should do. But they also like you doing your career. So nice. So everybody has their opinion, but you need to do it. And I remember in this particular session, she was telling like it's very hard for a woman to do all these things, and but you need to realize that you just need to go for it, and people around you will adapt. And sometimes you won't do the things they expect you to do, and sometimes you will change their perspective of what is right, because you can't always do what they think you should do. Like, imagine if your parents, you had your mother that was home with you, was home with the children. She wants you to go, but she can't imagine that it's okay for a woman to work till 8 and leaving your kids with the father or with the grandma. But in time they will adapt to you, and because if they love you, they will help you, and they will push you, and they will be there for you. And those who don't understand and those who won't help you and who will hold you back, you need to learn that you need to let them back, because on the way you will get new friends, get new family, but on the way you also will lose some. It's a choice, and as a woman, I think it's very important to know that as if you want career, it's a way of life and it's a choice. You can't please everybody, and you can't be this perfect mom and in the way other people see it. You can be the perfect mom in your world. And and in this session also, where this lady told us this, her son spoke to, who just finished the university, and this was so impressive because he told us how he grew up with a businesswoman as a mom, so it was never been the other way. So he didn't know another way. He was grateful for the grandma that looks after them when the mom was traveling, and that was okay because he learned that um, this woman was a career woman and was going to do her work to come further in life and to give them a better life. So I try to do that with my kids. I try to explain to them always what I'm doing, how I'm doing it, trying to make them understand. If they have questions, they come with me to work. They know what I'm doing. So I see they are also very comfortable with it. And we make agreements. We make agreements that I don't have a lot of time, but when I have, I make time for them. We want quality time. We make plans. So I learn them to plan things, because if I take the Saturday for them to do things, we have to do it, make it quality time, and we have to plan it, so we can be there the whole Saturday morning thinking of what we're going to do. So I think it's a lifestyle, and it's very possible because there are a lot of women in this world doing it, and in a level much higher than me. And I see all these kids becoming great people, and but it's a choice, and I think it's important to be what you choose for.
Correct. I like what you said. You can't be the perfect mother for the outside world, but you can be the perfect mother for your family. So your concept of perfect mother, I like that when you said that. because like you said, most often we think that we have to be perfect for the outside world, but forgetting that you with your family, your kids, your husband, etc., need to make what works for you. I like what you said about that you have to make what's work for you and your family, so that is important, and not what the outside world wants you to be as a perfect mother, wife, or whatever it is. So I like that one. When we going back to goals and the goals that you had, did you had to amend it along the way, or at the beginning when you started with practicing the dentist, you set your goals and those are the goals that you have been using or working on, or have you been amending them along the road?
Oh, I'm manning them a lot, all the time. No, that's not true. I think you have to put goals and stick with it, as long as they work. But I think also that you need to evaluate, re-evaluate time to time, and to change, to mend, put other goals, and it has been changed a lot. If I need to see back when I started in the medical center, it's a whole another setting than the goals I have now in Antique. In the Antique, I really want to bring structure. I wanted to make a machine. I wanted to be something stable, even if I'm there or not. So it's another vision, and I think it's important if you're starting that you go, like I said, step by step, because you have to keep the track, otherwise you lose it. It's important, the bigger picture, of course. It's very important to have a vision of the end, where you want to be on long term, in 10 years, in 20 years. But I also think that you have to put goals along the way, and to evaluate them, to check where you are right now, what have you done, how did you do it, so you can put new steps, you make new plans for how to go further.
Yeah. Yeah, that is something that especially the coaches and everybody does be saying. Have your goals, work on them, but then if situation change, look at them and see if you have to amend them or make new one as well. So yeah, and we keep on forgetting that we just starting, and then we have a goal, and then we don't ever look back at them, and then we kind of like lose track as well of the reason why we doing all what we doing. So that is
Yes, that's
true.
so true. That's so true.
When we go back to your practice, first patients that you get in your practice, how that goes. So you said that they come by you help them as a dentist, maybe cleaning the teeth, or I don't know, pull a tooth. Um, what can you give?
Whatever they need.
Now, if you get somebody that's kind of like afraid of the dentist, maybe hasn't gone for quite some years, and then is afraid now. How are you going to handle that?
Okay. I have to say that those kind of patients are my favorite ones. It fascinates me it challenged me to get someone comfortable. So I think that's the key for dentists. If I can get you comfortable, I can do my work. And if you're comfortable, I can give the best. So if someone wanted to start, like starting again with a dentist because they are afraid and they didn't go for a long time, we make an appointment just to take a look, you know, because there's a lot of people that are very afraid because they think that all these dangerous things and scary things are going to happen. But when they come, it's just cleaning or a little thing and that's it,
Yeah.
you know. But it's they're conscious because they didn't go so long that scares them. But what we do is we just make a consultation and take a look and start with that and maybe cleaning if necessary.
Mm-hmm.
And then we make a plan. And I think it's very important. I really believe um, that people are scared of the unknown. That's my philosophy. So I think if they know what's going to happen, if I explain enough, if I let them see enough, I have a lot of people that I want them to have the mirror in the hand when I'm working because I see them so intention, waiting for the pain to come, you know, but I'm not doing anything with pain or I'm just filling or cleaning a teeth. So, and I find it very interesting what I'm doing. So I want him to see it too. So I think those techniques are very important to bring comfort to someone and for them to reach that level because at one point you need to just let it go and um, and give yourself way to someone else that you're scared for and to so we can work on you. So
Yeah.
it's that comfort is very important for me. It's number one, someone that and I that makes a bond with a patient.
Mm-hmm. Correct. But
So
Kari
we
saying,
have one of those.
yes, exactly, and he needs a drink, and he don't even drink. And and Lance is saying that she too, but new tech is helping. My last cleaning was 5 minutes. Yeah.
Yeah, yes. Of course, the more you do yourself, the less we have to do for you. So, um, those Michael is sleeping.
Yes.
Okay.
No,
No,
but
but you know,
mhm.
indeed, the new techniques and like anesthesia. Nowadays, anesthesia, you almost don't feel anything. You know, most of people are afraid of the injections, but it's so small, so narrow now that you almost don't feel anything. And
Mhm.
again, it's all about the comfort, relax. So my priority is to get someone to that level that they just can relax. We have patients sleeping in a chair, like
Okay.
snorting in a chair, you know. But so it's possible. It's possible.
Yeah,
But
that's
we do
true.
everything. We do everything. It depends what I do the whole dentistry. I do smile design. We do bleaching. I do crown and bridges, porcelain, veneers, orthodontics, prostheses, implants, whatever you name it.
Mhm.
It's dentistry. We can do it. I do a lot of aesthetics. That's something I really like.
Mhm. Okay, but I find too that the dentist, there is a different when it comes to the dentist as well, because I can remember when I was younger, the dentist would not explain you what they're going to do in your mouth or what is happening, while now they're more open for, because I when I go to, like, for example, the dentist or things that I don't know what is going to happen, I want you to explain me while you're doing it. And I
Yes.
find that they're more open to do that, and they're not coming with, there she comes again. So yes, I find that from the dentist side, it's a lot of changes happening as well. So especially for
You
people
know,
that are afraid.
when I just started, I uh, put a lot of attention to
Mm-hmm.
people. I observed people a lot, um, and for sure, for in the first years, I worked like I told you with kids a lot.
Mm-hmm.
So you had to find a way to comfort them and to let them believe in you because Other way, if they don't relax, you cannot do your work. So, and I noticed that I listen to people. I talk a lot to my patients. I like to talk a lot, but I also think it's part of the job, again, to give them comfort. And I hear indeed that people that are so scared had bad experiences. And when you, most of the time, the bad experience was that something happened and it was pain and they didn't listen to them. They didn't know, or I told it was pain and he didn't stop, or he just pulled it out, or something like that. It's
Yeah.
always like the same thing. They didn't have anything to say. And I also noticed that with older people, older patients, that when I want to explain, they tell me, "You're the doctor, just do it." And telling it, no, I don't work that way, because it's your responsibility. If I pull the teeth, it's because you're giving permission. So you need to know what I'm doing. So I think it's a generation change. It's a another mindset. It's for sure been changing. And also um, in my time when I started, we started a lot on Versau here. I did a lot of that, giving prevention instructions, information. I had a TV series, I had a series on radio. I went a lot to a lot of schools, giving informations, um, talking to kids. I had a lot of schools coming to the clinic, and I really think it helps. I really think it helps, because, and another thing was like, I saw again, experiences, you have to see what you want and what you don't want. You need to learn from the mistakes. In Holland, we had this big clinic. They went to the schools, took the kids, bring them to the clinic, and we treat them and bring them back to school. So you never see the parents, and the parents don't know what happened with the kids. So next month they're coming back with 2 other cavities. So because nothing is changing. So that's something I said, I don't want that in my clinic. I want to talk to the parents. I need to educate the parents, because this will never stop. And I saw the result of it. I saw the kids changing, but I also saw the parents changing. The parents that never went to the dentist also are coming to the dentist now.
Nice.
And I believe in people, because there was a time, there was so many people telling me, "Oh, that's stupid what you're doing," because they won't listen. It's just the mentality here. It's just like that. You're talking, you're wasting your time. And of course, there were some that you really waste your time with, maybe. But there's a lot that listen and change, because I think you give them the importance. You give them, you hear them, you give them the attention, and then they elevate. I see that the kids are telling the parents, "You don't remember what the dentist said? You don't do that," things like that. So
Yeah.
it's very funny, and I really still believe in people, and that you can change the little bit you can do. You try your best.
Correct. Correct. That is true. Okay, so but Carrie is asking if you can tell a little bit more about the bleaching.
Bleaching, yes, that's teeth whitening. So it's if you want the Hollywood smile. I need to say that teeth whitening is not for everybody. I have a dental clinic. It's not a cosmetic center. You can bleach your teeth in shopping malls in Miami for $40, things like that. So there's a lot of variation on the market. What we do is dentistry. So it's with quality, and it's with the precautions necessary. And if it's not for you, I will tell you that. So with us, it's like you have to come. I need to examine you, see if it's something for you, because if you have fillings, we need to talk about it before bleaching. If you have sensitivity on your teeth, then we need to see if we can do it, because bleaching can make your teeth more sensitive. So, and there are a lot of people with has nice white smile and thinks they want to bleach, and they won't get a result. So I need to tell you that too.
Yeah.
So I think it's a thing of nowadays. It's okay. It's not bad for your teeth or something, but it's not for everybody. You need to check if it's okay for you.
Yeah. That
What I
is
can tell.
okay. That's true. So you're saying, okay, wow, that's good to know. Okay. Did you ever had to tell a patient no, they can't come to your clinic anymore?
Oh yes, I have. Um, those are the less pleasant things, but and also challenge as a woman, because I had not a lot, but I had like 2 or 3 patients, all the 3 of them men, that were too aggressive or won't keep to the rules of the clinic, or talking dirty to my people or to me, and that I rejected from my clinic, and I just set them out. Want
Okay.
to be? I had patients that use drugs, and when they come, uh, they are scared. Most of the time, all this is scaredness. Okay, they are just scared of the dentist, and they do weird things.
Mm-hmm.
But not everybody react the same. So I had this one client that had to come, but was under influence of drugs all the time and was very
Mm-hmm.
aggressive. This was telling us, so if you give me injection, I will slap you or things like that. So at
Okay.
one point, you just need to man up and tell them face to face, I don't want you here. And I had time that they waited for me outside because I
Mm-hmm.
told them I don't want them anymore. Um, but I think I always talk to people with respect
Mm-hmm.
and explaining again why and my point of view and why I think things should be like that. And
Mm-hmm.
uh, at the end, it's my call in my clinic. So
Yeah.
if you cannot
Correct.
respect is very important for me. Handle nice with my receptionist and everything. Um, then I can welcome you.
Yeah. Yeah. Lance is saying, these are things I've never even considered, and every business really does have some unique challenges. That is true. That is
That's
true.
very true.
Mm-hmm.
Are
Correct.
you Lancer is thinking about starting something?
You want to answer that, Lancer?
Lancer is always thinking about starting a business.
Oh,
But
okay.
I really enjoy hearing how you balance it all out, and just the idea of shifting from something you can do very well into making it run as a viable business, because I think for me that has been the challenge, to get myself into the mindset of business mode rather than the technical skill or knowledge that I have.
Yeah.
So yeah.
May I ask what you do?
Well, right now I'm an educator, but right now I'm doing massage, and I really want to go into aesthetics. So it's something I'm really considering, how to shift my mindset a little bit.
I can tell you something else. When I started on my own, it went so hard. Um, I think it's very important to give quality. Quality endures. Um, I think that's my success too. I don't, if I need to work longer, if I need to give more time, whatever it is, I always want someone to leave happy. Okay. Sometimes they leave with pain, but happy. um, but I can give you this advice: always give the best of you. I tell my colleagues always. I think this I learned this working at Holland at this big business what I told you for the kids. Um, Someone comes to you, one patient comes to you, but maybe tomorrow it's with another colleague. So I had this thing that my work needs to be perfect because tomorrow someone else will see it. So, but that's something positive, I think. And I'm always telling my colleagues, put that in your head. Tomorrow, if someone see your work, they need to say, oh, wow, okay, that's great job. You know, do it for yourself. Work every time like that. But be careful growing too fast. That's also a thing.
Mm,
And I think I can say that these first 2-3 years, I thought I just need to make money. I need to make money because I need to pay rent. I need to pay the assistant. I need to buy materials. I need to pay my house. I have kids. So I needed to work a lot. And if I work a lot, it will be okay. So I worked, and I got so many patients because remember I worked 5 years before. So I did it. I started all over again. But when people hear you and know where you are and hear your name again, they're coming back. So it grows so fast that at one point I couldn't manage it anymore. And at one point in my career, I stopped taking patients. I
oh,
had I had also one at that point that I took some patients and I brought them to my colleagues because I
oh,
couldn't
wow.
manage it anymore because the quality was going down. I wasn't in time anymore. I couldn't give answer in time anymore. I had patients with orthodontics plan waiting for 90 months. Things I forget to get back to them because I was on my own. It's getting too much. I couldn't do it all anymore, and I hadn't the personnel for it. I hadn't the
Mm,
structure for it. So growing too fast can also be a bad thing. So looking back, I would say think think about everything before you start. And the thing is that you don't know. You think you thought about everything, but
right.
I can tell at one point, and this is 3 or 4 years ago, so very late in my career, I got myself a business coach, and it's a lot of money, and I really didn't know if it was worth it or not. But that changes a lot, and you need that. So there's a lot of options.
Mhm.
So also that is worth the research for seeing what's and getting reviews and seeing what it costs to see if you can get some of these coaching before you start. And if you start, just slowly, don't invest too much if it's possible, of course, because there are some work that you can go too slow because you need equipment and you need to
Mhm.
invest. And if you need to invest a lot, you have to make the money. So you need to grow. So because you need to pay back. So you can imagine in a dental practice how with that unit, only that chair is more than my car. So I have to
Wow.
work. So but that's a little advice. Be careful also with growing too fast because also like you're working with massage and aesthetic. So you also, like me, have to be careful with your physics, your back, your muscles.
Right.
At one
Yes.
point, your body won't take it anymore if you don't take care of yourself. That's why I started working out. I'm not such a sportive person, but
Mhm.
at one point I had to start working out and building muscles because I couldn't take it anymore. My back couldn't take it anymore, working so long, so much days. So there's a lot to take care, and these kind of things, talking with people who already did it, you know, and so you can get attention for some points maybe that you didn't think about.
Thanks for that advice. Did you ever had a thought or a fear of failing?
Of a,
Failing, not succeeding at the business, at doing what you set out to do.
I think I would say yes. Um, on the question that not succeeding, um, I think COVID made me feel like that way. Um, I have 8 workers. I have a building. I have cars. I have debt. So at that point, I was like closing the doors for 2 months and not getting any help because we didn't get any help of the now and anything. And seeing all these families that depends on me, and I just couldn't pay at all, gave me the feeling that I didn't do it right. But at one point, I talked again with people that are farther than me, like the business coaching also. And I realized that I'm starting business. I'm in October, it will be 3 years that we open the doors of the antique. So we are starting. So we are not so stable financially yet. So these are things that you need to just accept. These are phases in the process. You just need to accept it, that it's part of it. It's some phases that you will go through in the process. And at that point, when I thought, okay, it's not that I didn't succeed, but it's the way it is. We did okay, we did right, and we are at a good point. But this is something that I hadn't see coming. Nobody started coming, and I don't have it in my hands. So how am I going to solve it? So so I talked to my people, and it wasn't nice, and it was, but everybody knows what's going on, and they had an understanding, and we helped each other. We helped each other, and we agreed in starting working harder to get back on track. And then I thought I really succeeded because I have a great team. I have a great team. I have the patience. I have the equipment, everything. So afterwards, I think that we do it. We are doing right. We are doing okay. But I think there's a lot of times in the process that you will feel that you're failing. But it's very important, like I said before, that your vision is clear and you're going back to your basic. Why are you doing this? Why did you choose to do this? Because these are things that you know before that they are coming. They are coming not only for you, it's for everybody the same. It's part of the process. And like someone said before, the disappointments that you can take strength out of them and just try to do it better, learn from them. So disappointments will be there. And the thing is that when it goes wrong, it's all you. It always will be your fault. And at one point you need to accept that and say, it's okay, okay. Then when it goes right, it's all me.
That's true. When we staying on the COVID, Bakari is asking, how do you as a dentist maintain the health and safety protocols? Because you open back your doors, right?
Yes. Yes, we are maintaining our health by the all the rules. We are keeping the distance for the patients, of course, not in the chair with us, but like the waiting room, we put our chair outside, everything is outside. We are not so close in the air condition. We open and ventilate more. We have our hand sanitizers. We keep distance for the reception. Our clothes, we are used to work with gloves and masks. So now we're still using that, but we also use the shield. But those are things we are used to. And cleaning before and after every patient, sterilizing every instrument. So I need to say it's not much difference for us because we are used to do like that. So there are little things that we add on, like putting plastic folies on the laptops, you know, that you can clean more easily, and our kids corner, we put away the toys and things like that. But the situation in Curacao is quite under control. We are, of course, we screen our patients asking if you're coming from abroad or not, if you have any symptoms, things like that.
Okay. Okay. Yeah. Okay. So thank you. I think we reach our hour. Is there something you want to say as a closing? Maybe another advice or a tip?
Okay, I think we said a lot, and I give a lot of advice, but I can say I really think that bottom line of it all, you have to be aware what you're doing. Be aware, bewust, because what I said, the most of all, the biggest problem is that we think we're gonna be a business owner as a technician, and I think that's where it goes wrong. So look for this information, talk to people, inform yourself before starting. Don't be scared. Don't be I'm not telling this because for you to chicken out, but be prepared. Be things that went wrong with other people, learn from them. You don't have to. It don't have to go wrong with you too. So talk to people. I talked a lot to people with experience. Look, take care who you talk to, okay? Because it's true that it's lonely on the top. And on the way, you will find so many people, and hard enough, you will lose some too. You know, and but be prepared, live your dream, but work with passion, work with love. You have to love what you do because it's not easy. And the only way to go through all this laughing and enjoying it is because you love it. And I think that's from my point of view as a technician, because I'm also a business owner, but as a technician in the business. And it's not easy, but not impossible.
Well, thank you, Miss Carina. Tonight, by Mindful Elevation, we had Carina Engelhardt, who is a dentist, where we have been talking about how it is to build up your business, that you have to have your vision in place, work on your goals, see if you have to amend your goals. She has been talking about different challenges that she encountered in the years that she has been building up her practice, but also some positive things. How you have to, if you want to start your business, try not to get discouraged along the way, but keep on working on your vision, and also of course learning from the different experience, and especially as well talking with other people, but of course taking into consideration the information that they're telling you, what you can use and what you cannot use. So Gina was saying there's very nice presentation. She thanked you a lot and she received a lot of information. And Lancer is saying as well that she really enjoyed this session and she thanked you as well for this session, and also thanking me for an under lively, interactive, and informative session. So you're welcome. And again, thank you very much for accepting our invitation. And
Should I get bodyguards?
I guess for when those people, the men coming and
Oh, I can handle them.
Exactly. Thank you so much for your time, and thank you everybody for being present again. We appreciate that very much. And if they want to how they say it, go to your practice as a dentist, how they can contact you?
The easiest way is we are located on Curacao, of course, and but you always can contact us via our Facebook page, Dentique Curacao. Dentique like in boutique, Dentique Curacao.
Okay, well, thank you very much for that. I enjoyed it as well. Of course, I know you for quite some time, and I have been hearing here and there how your the building up of your business has been going. But I got quite some new information as well, so I appreciate that, and I thank you for that. And I want to say to everybody to enjoy the rest of your weekend and to have a good evening.
Thank you very much for the invitation. I think it was very interesting, and I hope that we could have been useful for some new entrepreneurs.
Yes, for sure, for sure. Thank you.
Okay, have a nice night.
Thank you. You too. Bye.
Bye.